pediatric speech-language pathologist, and welcome to TeachMeToTalk.com's Therapy Tip of the Week. When I asked readers what kinds of new ideas they would like to see on Therapy Tip of the Week, one mom asked me for suggestions for teaching body parts. Now remember, long before we expect a child to say the name of a body part, he has to indicate that he understands what we're talking about or that he identifies the part receptively. And this would just mean, in plain language, for those of you who are not therapists, when you say, "Where's your nose?" that a child would be able to point to and show you that he understands the word nose. Now, learning body parts is an important developmental milestone, and it's included on nearly every checklist of skills that you would see to assess a child's language development and their cognitive development. So again, it's something that you'll hear a pediatrician ask a parent about, and certainly something that's included on our assessments of how a child would understand language. Let's talk about what's listed as normal so you'll have an idea of what the expectation really is. By 12 months, a child who's typically developing should be able to point to 2 different body parts. By 18 months, a child should be able to point to 6 different body parts on either himself or on, say, a little doll or on something like a bear when he's asked. You could also include clothing items in that. A lot of tests will say 6 body parts and or clothing items there. Now, if you're a mom and you have a child who is not yet doing that by these ages, don't freak out. I am not fond of scaring parents, but I do want you to know if you have a 2-year-old or a 2.5-year-old who's not yet doing these things, that's a real red flag. And it really lets us know that language is not coming along and language is not developing as it should. And some moms will discount it and they'll say, "Oh, he just doesn't like it when I teach him these things." Or some moms might even say, "Well, I've never tried to teach him." That's probably not the reason that he's not understanding, but purposefully working on it can't hurt. And sometimes with a little direct teaching, we really do see incredible gains, particularly in the area of receptive language. So I want you to focus on that. Now, don't let that term direct teaching scare you either. All this means is that you're going to get really, really purposeful and be really, really consistent with how you work on this with your own child at home. Now, if you're a therapist, we need to remember that when we're helping parents learn to do these things, we need to give them ways that they can easily incorporate working on language targets into their daily routines. So when I begin to talk with families about, one of our goals is to help your child learn to understand body parts. Before we even talk about what to say and how exactly to do it, I like to start by talking about when we do it. So they get the idea of how often they need to work on this stuff. So naturally, changing time and bath time are 2 daily routines that parents do every day. Changing, of course, multiple times a day, and that really kind of sets up the expectation that a parent would work on it this many times. I also, again, want to be sure that I'm stressing to parents that toddlers who don't understand what words mean need lots and lots and lots of repetition. So a child just can't work on body parts with me in a therapy session and learn them. I mean, he can, but it's going to take a lot longer than if mom and dad work on these kinds of things at home too. So you're going to help a parent develop a little routine that they would use every single time or almost every single time that they would change their child or give their child a bath. And again, you're going to really emphasize how important that consistency is. Sometimes we just have to tweak the frequency and a child will learn it. Sometimes we have to overhaul the whole darn routine so that a parent is doing things completely differently to teach a child to understand body parts. And I want to talk to you about the best ways that I've found in my career and the things that parents have given me most feedback on. All right, so let's talk about something that parents do wrong, not wrong, but that they may be doing that to address body parts that may not work for a particular child. A lot of times moms and dads just try to teach the body parts that are right here. What? Eyes, nose, and mouth, okay? Those are fun and those are important, but when you have a toddler who's really struggling to understand language, sometimes that doesn't make sense. Or he only kind of understands it in the context of reaching for mommy's nose. or getting mommy's hair. So what we really want to do is teach him on his own little body. And so I like to start with things that he can see. And sometimes the therapist will say, well, let's just work on it in the mirror. We'll look in the mirror. Sometimes that kind of backfires and the child does other things and he still really doesn't understand what you're getting him to do. So for that reason, I like to work on the body parts belly and toes to teach first rather than facial body parts, because the child can see those kinds of things and he can get more feedback. And again, sometimes when we're teaching everything here, eyes, nose, mouth, ears, even if a kid's trying, it's just too close together for him to be on target. So split it up and teach belly and toes and hair. And again, I teach them in that order so that a child has more of a shot at getting closer, and especially because they're a little farther apart on his body. Now here's how I do it. Now I'm going to model this for you, and it's going to sound a little crazy and a little unnatural because I don't have a child here, but I want you to see and hear how excited you need to be when you do this, how you can really use your voice, your affect, your facial expressions to really help a child want to learn these things. And again, that's what a lot of parents say. They say he's not interested in body parts. And then I'll kind of think, well, if you were being that boring with it, I wouldn't want to learn it either. So we've got to be a little bit more exciting. So what you'll want to do, and again, because the child is usually laying down for changing time, we would say something like, where's your belly? Where's your belly? I'm going to get your belly. And then you're going to tickle the child's belly, or, that's what I would do as a therapist. If you're a mom or a dad, you may want to kiss the child's belly or blow on the child's belly or anything like that. And you're going to give them that immediate reward for finding their belly and doing something really fun to make them want to point to what you're asking them to do. Toes are fun to do that with too. I pretend to eat kids' toes all the time, and they just think that's hysterical. So again, that extra little motivation piece when I'm doing hair, I'll scrunch my fingers on their head like I'm washing their hair, and lots of our little sensory friends will just kind of melt because that feels so good to them. So teach those body parts first. And again, you're going to really emphasize to parents how often they need to do it. So they need to be playing this little game. As they're doing Where's Your Belly, play it 5 or 6 times in a row when you change the kid's diaper. And then 2 hours later when you change him again, you're going to play it 5 or 6 times in a row. And then 2 hours later, 5 or 6 times in a row, so that they understand they're supposed to be doing this consistently throughout the day. Now, another way that we can reinforce body parts is by singing little songs. Now, let me share with you 4 versions of songs that you can use. And again, this would be to really practice body parts. And I'll teach a parent some of these things as we go, as we're working on belly and toes, and I'll tell them this is just kind of, again, to reinforce, and I would really want to see some progress with belly and toes before we're going to move on to include these other kinds of body parts. And I like to teach parents to sing songs to well-established tunes, so they're not trying to remember, how does that song go? And they're not trying to come up with something that's too terribly difficult. So all of these are based on other little nursery rhymes or other little songs that a parent would have already sung. So the first one is to Here We Go Round the Mulberry Bush. Now, you may not remember it that way. You may remember the song as This Is the Way. Do you know that song? And so I'm just going to sing it for you here. Let's use ear. So we would sing, this is the way I touch my ear, touch my ear, touch my ear. This is the way I touch my ear early in the morning. Now, as you can hear, I am not a Broadway singer. I am never going to win American Idol, okay? But that doesn't matter. And you have to get over that fear of singing in front of people, or if you're a mom and you think, oh, my child doesn't like it when I sing, or I don't have a great voice, or I'm embarrassed, don't worry about that. Kids don't care. And even if you do find a child covering his ears, it's because he has an auditory sensitivity. It's not your voice. So don't worry about how horribly you sound, and just go ahead and sing. And so again, I like that version. You can do, you'll teach ear, you'll do nose, even move on to do something like leg and knee or elbow, those other body parts, especially for children who are moving along with that. All right, that's a great version too for kids who don't yet point, because you're really talking about touching something, and that lets them know that you expect for them to respond by showing you with their little bodies. And even if they're not using a real index finger to point yet, that's okay, because they've got to kind of move toward that anyway. Now remember, you are not going to expect your child to sing every word to that song. Don't get all caught up in that. At this point, we're just teaching them to understand what the word is, and to understand when you say ear, you mean for them to touch their own little ears. And when I'm introducing these songs too, I perform the little motion. I touch my ear and I also touch their ear. And there'll be another song again in a minute where you're going to specifically touch their little body part. But remember to do it both ways. I've had children that when I haven't really talked about that with a parent, they can only do the body part on their parent. They can't do it on themselves. So be sure that you're really teaching that skill kind of both ways. Now, at the beginning, a child really may not understand what you're saying. They're still not understanding this is ear, but that's okay. He's just imitating your action, and that's where we start. Over time, he'll link that meaning to the word and get the correct body part. All right, here in this version, this is the little song that I found on KDA's great blog, Playing with Words 365, and it's to the tune of Mary Had a Little Lamb, and I love this version too because you personalize it and you say the child's name, and again, this is where you're really touching him. So let's just say we're working with a little girl named Amy, okay? And so we'll sing something like, Amy has a little nose, little nose, little nose. Amy has a little nose. It's oh so nice to tap or touch. Or again, you could substitute tickle or kiss or pinch. That might be fun. That might get a child's attention, right? So you want to keep it novel, want to keep it fun, and you can use lots and lots of repetition with those kinds of things. And again, you're not going to want to teach 12 body parts at one time. Just pick 2 or 3 and work on that. If you don't like those versions, let's try this one. Do you remember Where Is Thumbkin, that little song? Well, let's think about using that to teach body parts too. And again, I like this version because you're really asking a question and you want the child to respond. So you're singing, where is your eye? Where is your eye? There it is. There it is. Touch it with your finger. Touch it with your finger. Just like me. Just like me. And again, you're working on that skill of pointing. You can do it on them too, but you really want them doing it on themselves. And they can do it on you as well, but again, move them toward pointing to their own little body parts. Now, the last one that I just love is one that everybody knows, and again, it's head, shoulders, knees, and toes. And I'll tell you, I teach this one a lot with groups of children. So say you have siblings that are there participating in a therapy session, and you're thinking, what am I going to do with this 4-year-old in addition to this 2-year-old? Older kids like this too. Or in a daycare, you could really use this song. And so you know the song, right? Head, shoulders, knees, and toes. I'm not going to sing it for you. You can Google it or YouTube it if you need the words and the tune to that one. But I love it because it has those big body movement components there with head, shoulders, knees, and toes. I like to do this when we're sitting down too. So it might be a way that if you have kids up running around and you want to bring them to you and get everybody to calm down and settle down, this might be a good way to do it. Another thing you can do with the group is really sing it slowly a couple of times, and then for the last time that you sing it, say, let's sing it really fast, and sing head, shoulders, knees and toes as you're touching, and kids always, always, always think that is a riot. So now I hope you have some new ways, some 4 different songs, perhaps new songs that you've never heard before for teaching body parts. Surely you can find one of those that will work for you if you're a mom. And again, if you don't like singing the same thing over and over, I've given you some different versions so you can practice the same skill in the context of something and switch it up a little bit so you don't get so bored. Now, if you need some additional songs to sing and some new routines, and again, something to kind of spice up what you're doing with your own child, and certainly in therapy sessions, let me refer you to my therapy manual, Teach Me to Play with You. It's a whole book of songs, and it's done in a homework format so that you can do an activity with the family, make them a copy, hand it to them, and say, here's your homework for the week. go for it. This is what I want you to practice, okay? So I wanted to be sure to mention that resource to you. And you can find all of those products at teachmetotalk.com. All right, that's all for this week. I'm Laura Mize. Thank you so much for watching, and we'll see you next time on teachmetotalk.com's Therapy Tip of the Week.